Hello, everyone. Our Sentinel Event topic is suicide after care. This will be presented by Anaidis Valenzuela, Danica Jackson, Katrina Medina, Martha Alvarez, and Natalie Rico.
What is suicide? Suicide is when people harm themselves with the goal of ending their life and they die as a result. There is a whole suicide process we are going to talk about, and then it is said that suicide thoughts may be brought on by a major life transition, such as death of a loved one or the end of a relationship. The image attached goes over the suicide process. This model outlines the process that leads to suicide and includes contributing factors that drive the progression through different stages. Neurobiological and neurocognitive factors that may have been impacted by genetics or trauma factors impact upon the individual's appraisal system. This system entails appraisals of oneself, one situation, and others, and is valenced either positively or negatively, with the latter potentially resulting in a sense of defeat and entrapment, and then progressing the suicide process. When this sense of defeat and entrapment increases, especially within the context of belongingness, perceived burdensomeness, or humiliation, the desire to escape arises and suicide ideation develops. Rescue factors at this stage entail awareness of problematic thoughts and reframing these to facilitate rescue. Within suicidal ideation, the presence of pain and a sense of hopelessness further increase the need for escape, and suicide becomes a viable means by which to achieve this. At this ideation stage, if help and social support are sought and received, then ideation can be minimized. However, if pain continues, the chance of relief from the pain drives the suicide attempt, which, when combined with volitional factors, leads to a suicide attempt. Factors that facilitate a suicide attempt include disposition and capability. When suicide capability is high and the individual has the disposition to attempt, and if the individual has access to means, then a suicide attempt is likely.
Next are some general statistics on suicide. More than 1 million people attempt suicide each year in the United States. Suicide is the 10th leading cause of death in the US and is in the top 20 worldwide. Every year in the US, suicide accounts for more than 40,000 deaths and 500,000 emergency department visits as a result of intentional self harm. Nationally, between 49 and 65 hospital completed suicides occur, and nearly 75% happen during psychiatric treatment. 80% of all deaths by suicide in the US are among men and women ages 45 to 54. Men ages 85 and older have the highest rate of any group in the country. Additionally, I would like to share that September 10th is International Suicide Awareness Prevention Day, and the dedicated Suicide and Crisis Lifeline phone number is 988, which is available 24 hours a day for those in need. This slide provides facts specifically on maternal suicide, and the data is provided by 2020mom.org. Research shows that suicide is the leading cause of maternal death in the first year following childbirth. This suggests that maternal suicide deaths are more common than maternal deaths caused by other medical issues, such as postpartum hemorrhage or hypertensive disorders. Suicide accounts for up to 20% of maternal deaths that occur during postpartum and is frequently completed between 6 to 12 months postpartum. Thoughts of suicide increase dramatically as a result of depression during pregnancy and to the severity and rapidly evolving nature of postpartum psychosis. We have here additional statistics on postpartum suicide. About a quarter of women who died between 6 weeks and 1 year after pregnancy died as a result of mental health related causes. Suicide is among the top three causes of pregnancy associated deaths, as defined by the CDC. Research suggests there is an approximately 5% suicide rate and 4% infanticide rate associated with postpartum psychosis. Stillbirth occurs in 1 in 160 births, which equates to 24,000 stillborn babies each year in the US, and approximately 2,600 out of 595,200 insured mothers aged 15 to 44 across the US had suicidal thoughts of self harm, a number which has tripled between 2006 and 2017.
Depression is different from regular mood changes and feelings about one's everyday's life. It can affect all aspects of life, including relationships with family, friends, and community. Depression can happen to anyone, but studies show that it is more common in women. There are effective treatments for depression that vary from psychological treatment to antidepressant medications. To be diagnosed with depression, the symptoms must be present for at least 2 weeks. So, during a depressive episode, a person may experience a depressed mood such as feeling sad, irritable, or empty. Here are some symptoms and patterns of depression: poor concentration, feelings of excessive guilt or low self worth, hopelessness about the future, thoughts about dying or suicide, disrupted sleep, changes in appetite or weight, feeling very tired or low energy. So, not everyone who is depressed experiences every one of these symptoms. Some people experience only a few symptoms, while others experience many.
JB, who was known as a frequent flyer to our emergency department, was admitted and brought in by ambulance on a 5150 hold for suicidal ideation. JB is a 31-year-old transgender female and has a medical history of bipolar disorder and anxiety. In previous ED visits, JB had struggled with familial problems, especially with her mother, who often called the police on JB for threatening self-harm. The story was always reoccurring with JB, stating that her mother drove her crazy, in which she would respond with wanting to commit suicide. While being placed on a 5150, she was allowed to call her mother, which resolved in apologies. She was never admitted to an acute behavioral center for longer psychological treatment, but instead cleared of any immediate threat to harming herself or others. In October 2021, it would be a different ED visit for JB because it would be her last. The psychiatrist was familiar with JB's story and still cleared her to go home after being held for 24 hours. Afterwards, she had a follow-up visit with the mental health department. It was then informed to the ED that JB had obtained her mother's opioids and committed suicide.
Even though we may not be able to prevent all suicides from happening, it's very important that we have the best resources available when needed. As a healthcare clinician who could see all the available appointments for Northern California for my company, it's sadly to say I have seen appointments not available until about 4 months out. In this case, besides prescribing medication to patients, which may not even be effective for 2 weeks, we most definitely have to do better by improving access for suicide care, creating protective environments, promote healthy connections, and even finding ways to deal with financial hardships. Support groups that teach coping and problem solving skills, being able to identify when a person is at risk and how we, as friends, family, peers, can help, and what we can do to prevent future risk.
This is a 5150 form. A 5150 is a documentation which states a person with a mental illness is to be involuntarily detained for a 72-hour psychiatric hospitalization. It is typically generated by a peace officer or sheriff deputy in the state of California. If it is determined that a patient needs further treatment, then they would be placed on a 5250, or if the patient is still waiting for hospitalization placement while in the ED, the 5150 would be renewed before the 72-hour hold is expired.